Hey y'all, on this Chit Chat Snackable, oh, we have something juicy to talk about. We talked to Nurse Erin Olszewski, who spent time on the front lines of the coronavirus pandemic. Now, while she was working in New York's Elmhurst Hospital, known as the epicenter, she talked about how she witnessed gross negligence, medical mismanagement, and even death. Now, although cases have gone down in New York, but during the height of this pandemic, COVID-19 deaths rose to over 32,000, making it the hardest hit state in the country. Now, if you want to know a little bit about Elmhurst Hospital, it can be traced back to the mid-1800s, an institution known as City Hospital. The hospital was built to serve the poor, and is one of New York's second oldest municipal hospitals. It also played a major role in treating victims of the 1918 flu epidemic. But did you all know that back in March, Governor Cuomo of New York issued an executive order granting immunity from civil liability for any injury or death alleged to have been sustained directly as a result of an act or omission by medical professionals? And let us not forget, when he signed that executive order allowing COVID-19 patients to go into nursing homes with non-COVID-19, killing over 6,000 seniors across the entire state. Oh, but that's a whole nother story that we have to dig into. Look like somebody may have blood on their hands. The nurse who turned into an investigator, recording and documenting footage of the sick and sinister foolishness that was happening under everyone's nose, is here to talk to us about what she experienced and what she saw.
This patient is in with like a non-COVID. I don't understand why they're doing that.
I know. There's 4 patients in a row here non-COVID. And this is supposed to be the COVID.
Yeah.
Because 7th floor, they shut it down.
That's right. I'm confused.
And then they're going to have non-COVID there.
Yeah.
This is going to be the only COVID, so they shouldn't put any non-COVIDs here.
Well, that's what they've been doing. The guy over in 29, I had him upstairs because I was on CCU before it.
Yeah.
And he came in with a stroke.
I know, that's what 26-1 was, a stroke.
And no COVID. And now he's got COVID, and he's on a vent.
Well, because we gave it to him here.
Okay, so we're talking to Erin. Erin, I have a whole host of questions.
Yes, a lot.
Yeah. My first question is the difference between working in Florida and New York. What was the difference?
The treatment, the whole entire protocol, all of it. In Florida, we treated the person as an individual. We looked at the whole big picture. We also wouldn't go immediately to a ventilator. We would try other treatments. For example, this is like one of the biggest differences that I noticed between Florida and New York was that we used, and we were successful using, the hydroxychloroquine and zinc protocol. And when I got to New York, that wasn't the case. It was banned. We couldn't even use it even if we wanted to. And the crazy thing is that there was a liability-free environment, correct? Healthcare workers were liability-free, except if they use the hydroxychloroquine for off-label use, aka if they use it for COVID those physicians would be liable and they would lose their job, possibly lose their license.
Oh, okay. So let me say this here. Let me make sure I'm clear about this here.
Yeah.
So if you worked at the hospital, you couldn't use any of the hydroxychloroquine. You couldn't use any of it. But if you decide to use it, the doctors were liable. But any other thing that they did, they wasn't liable for.
Correct.
Wow. I know. Yeah. Go ahead.
So did anybody argue or mention anything about the right to try law that was written into place?
I did. So when I first got there, I just realized that there was such a vast difference in the way we were treating our patients in Florida versus when I got to New York. I couldn't believe it. And early on, I reached out to an attorney friend of mine. I'm like, listen, no one is going to believe this if I don't have some sort of proof. So we started getting proof via video and audio. I had recorded a doctor that I asked him specifically, well, why can't we use the hydroxychloroquine? Why can't we use any alternative treatments for these patients?
Right.
They didn't want to.
They just didn't want to.
His answer was, they don't work. And I'm like, well, they were working by me. In Florida, we didn't have all this death. We didn't have any of these problems. And, you know, he didn't really have a good answer. He goes, that's not the best protocol. And I'm like, well, listen, these patients are dying. You just admitted that if they're on a vent, the chances of them living are slim to none. He just admitted that at Elmhurst, none of those vented patients went home. None of them have been successfully extubated. So I'm like, what's the harm?
Okay, Erin. Okay, let's break this down. Somebody goes to the hospital. They claim that they may be having shortness of breath, that they have a fever. What determined how people was checked into the hospital, how you were admitted? If you were thought to have COVID or if you had COVID?
Yeah, what were the symptoms?
Yeah, we know what the symptoms was. It's shortness of breath, it's fever. We know that.
Right.
But when you get to the hospital, what was the protocol for them even to be admitted to the hospital?
Okay, yeah.
So they weren't admitting anybody that wasn't, like they turned the hospital into an all COVID hospital. Okay. So, you know, now that didn't mean that everybody admitted had COVID, which I found really interesting. And anyone that, you know, you don't have to be a rocket science to figure out that if you're going to admit somebody that's a COVID rule out while they're waiting for a 5 to 10 day test, you're not going to put them on a COVID floor, right?
Stop right there, Erin. If the whole hospital was the epicenter, are you telling me that every floor was a COVID floor?
The majority of floors, they had a medical surge floor, but they were still admitting COVID patients there. So they were admitting patients, either they were COVID positive or they would be considered COVID rule out. So a COVID rule out, which I found, this is another question I ask, and you know, you ask questions and they don't like that, but I don't care. I'm like, these are patients' lives right now. And the entire United States is looking at this hospital in particular and basing all of their recommendations off of this. So, but I asked the doctor, and there was rapid tests that we could have done at that time. Rapid tests are 45 minutes. So in the emergency room, we can rapid test someone, know if they have, you know, they're positive or negative. They bypassed that. They didn't use it. And the doctor said it's too expensive.
Hold up.
Wow.
So did the hospital have them on hand, or they just didn't want to, or did they have that particular, the rapid test on hand? Was it inside the hospital where you can get your hands on it?
No.
Okay, so the hospital wasn't doing rapid tests. What they were doing was this, how many days? 5 to 10 day test?
Yeah, approximately. And in the meantime, they admit these patients that usually didn't have COVID to a COVID floor. So ultimately, those patients end up getting COVID.
Right, right.
Let me make sure I got this straight, Erin. Let me make sure I got this straight. People will come to the hospital. They wasn't tested for COVID. I'm gonna throw this in there. If they had something else, maybe they was having heart palpitations. They still was admitted into the hospital and placed in with COVID-19 patients, positive patients. Is that what you're telling me?
Yeah, they would do a test on them. And they would send it out. But in the meantime, they would admit them to a floor, and they would wait for the results.
But okay, now let me ask you this here. As a nurse, what is the protocol for being admitted in the hospital? Like, they don't just admit you in the hospital because you may feel a little sweaty. I mean, what was the protocol for them even admitting people into the hospital and just placing them on these COVID-19 floors with other COVID-19 patients, and then doing a test that's take 6 to 10 days to come back? By that time, that patient, they may have caught COVID. But what is the protocol for them even admitting these people in the hospital like that? Was it a new rule?
The problem is that all liability was removed from all healthcare providers. And so it ended up becoming a free-for-all. And then already, the people that are coming into this hospital specifically, a lot of them are on Medicare and Medicaid. A lot of them don't have, the means to be able to fight the system per se. So they were essentially, and this is my opinion as an observer, as being in there as a nurse, is that they were essentially taken advantage of. And their lives were lost because of that. Mismanagement, malpractice, gross negligence, you name it, and it was happening. And guess what? If you ask any questions, bye. I was kicked out. But not before I got proof.
Okay, let me ask you this, Erin. So if someone came down with COVID, the treatment protocol, did they immediately want you all to throw them on ventilators, or did they follow a specific protocol, a specific plan, so that they wouldn't go on to the ventilators?
Like a process of elimination.
Right.
Oxygen.
Yeah. So, there's good and bad apples on every tree. So there were doctors that would try to put them on a BiPAP or a CPAP early on. But that doctor goes home, the new doctor takes over on a different shift and is sick of dealing with it because it's a lot more work. You got to keep going in the room, checking on the patient. And it would be easier for them just to put them on a vent. And a lot of nurses that saw that this was happening fought back, what are you doing? He doesn't need a vent. He doesn't need this, or she doesn't need this. And, they didn't listen, because it was honestly a free for all. A lot of the residents, they have the book smarts, but now they need the clinical skills. We're running the show. Well, early on, and before I got there, I was trying to figure it out, what is really going on? Where is this coming from? And grasping at any doctor or scientist that was speaking out. And I ran across Dr. Cameron Kyle-Siddell.
Okay.
And he, early on, this was mid-March, stated that, we're doing it wrong, people. We're doing it wrong. We're treating people wrong. We're not, it's the wrong thing. It's in the blood. It's a blood issue. And they knew this. I brought the science to them. I showed them, and nobody wanted to hear it. This is affecting people's bloods. When I would go to take, their blood for lab work, it was almost impossible for me to even fill up a lab tube because it was so thick it would stop. So I can't explain it, but all I know is that it's in the blood. If the blood is clotting, that's our main oxygen source to our organs and our body. And they knew that. But
the test that they were taking was the swab up in the nose, correct? It wasn't for blood, it was for mucus.
Correct. Yeah, I don't know. I don't even know how accurate those tests are, to be honest with you.
Okay, so I'm sorry, one more. So when you just mentioned something about the oxygen leaving the organs in everybody's body, it sounds like a person would need oxygen versus a ventilator, because it does not sound like something was wrong with the muscles of the person's lungs working. It sounded like oxygen was not getting into the person's body. So with you being a nurse, did you know that a ventilator was not what a person needed if their lung muscles were still working accurately?
Yeah, it was awful because we would literally be begging them, like, please, like, but they wouldn't allow any alternative treatments. And you know, the thing that bothers me is that there was an incentive to put patients on a vent, and that's sad. Like,
what was the incentive?
What was the incentive?
$39,000 per patient on a vent.
Wow.
Let me $39,000 for a patient. Let me ask you this here. As a nurse, you went to nursing school, you follow the protocols. They have specific protocols for things. When you got to this hospital, the epicenter in Queens, New York, did the rules change? Things that you were supposed to know or should have known, did all of that go out the window? And if it did, who ordered that? Who ordered that? I keep hearing the higher ups. Who were the higher ups?
Good question. I'm asking too. Nobody knew. Everyone blamed it on, it's our higher ups. Like, who are they and where are they? But you know, yes, the majority of protocols that the average doctor, nurse, staff learned throughout their years in school went out the door. For the majority, yeah. And it became where people were just kind of conditioned to say, this is how it is, just deal with it, they're gonna die anyway. Wow. And like, I'm a mom, you know, like, I can't even imagine if that was one of my children in there and I can't be in there with them.
Right, you can't see them.
Family are kicked out.
Wow.
So what do they do? You know, like, they're at an event. They can't even talk to you at that point. You know, you gotta be there for them.
Erin, how many people did you see die?
I didn't have one patient live.
Wow.
Yeah.
And this was one of the low-income hospitals, a hospital that most minorities go to. And I don't understand the governor of New York. How can he claim Black Lives Matter to him when all of the protocol is thrown out of the window? And you have people just doing whatever I guess they want to do, or according to what the higher ups want them to do, even though looking in, I'm questioning people, even their integrity, as to, you know, to go along with
morals, the values. And, you know, even just hearing you say that this is a hospital that serviced minorities. I understand, okay, Black people are considered minority. Was there also Hispanic people there as well?
Right.
Yeah, that was the main population in this hospital is African American, Black, Hispanic, and Asian. And they were treated like they were disposable humans.
Wow. Wow.
I have a friend that worked in the emergency room, and she said they would bring a lot of homeless in through the emergency room, drug them up, and send them to the floors.
Okay,
so,
wait a minute.
Yeah.
So let's bag it up.
So the homeless will come through the emergency room, correct?
Yeah.
And then when they get into the emergency room, what would they do to them?
Well, they didn't really come on their own, though. This is a friend of mine that was also a travel nurse. She was working in the emergency room, and the police would bring them against their will. Maybe they were sleeping, drunk on the street. I don't know. She just said that they would bring them through, they'd drug them up, and these people would be like, I don't want that. Haldol was the drug of choice. They would drug them up, send them to the floors. That's why how do you stay quiet in this type of a situation?
You don't stay quiet.
Wow.
You have to open up your mouth, because people like me, I knew something was going on.
Yeah.
I just couldn't put my finger on it.
Yeah.
There was too many people dying. Why wasn't lives being saved? And I started hearing little stuff, little chatter.
Yeah.
A chatter coming from certain hospitals, certain protocols wasn't being followed.
And everybody kind of saw it.
Right.
You know, when you see it and you've been conditioned to be quiet or else, it's been this stigma that even though you see me killing somebody, you can't say nothing at all, or you're going to get fired.
Right.
And the protocols, if the proper protocols are not being followed, then blood is on somebody's hands.
Yeah.
Right.
There's a big portion of this is, so the agency that I went through was funded through FEMA. So when we first got there, I sat for 3 days. The people before me that were there sat 18 days with no assignment. Meanwhile, it's a pandemic, right? You know how much we were getting paid over there? $10,000 a week. Now, is that hush money? I don't know, but that $10,000 a week doesn't mean anything to me when they're essentially murdering people in these hospitals.
And that's $10,000 per person, right?
Well, I was making, with this agency, along with every other 1,000 nurses that got pulled, into this pandemic there, $10,000 a week, per week to work. Per person.
Even if you sat in the hotel.
Correct. I was making money every single day. There were some people there almost 20 days making $10,000 a week. So why is there this mismanagement of FEMA funds? There's a lot of different aspects to this.
That's right. You are absolutely right. Listen, people were writing, telling us certain things. But they wanted to make it look like we were spreading misinformation, and we knew it wasn't misinformation. Yeah. So let me get this straight. FEMA put nurses in hotels. But what was coming out of Governor Cuomo's mouth was that we don't have enough personnel. We need more nurses. We need more respiratory therapists. These people were already sitting up in a hotel. Yeah. And what they did was, it sounds like, and you just let me know, that they make your environment so chaotic, meaning you could have 100 patients, but it was only 10 of you all treating them.
Yes.
Okay. So what
that
they
was intentional.
That was intentional.
Yeah.
So what they did was, even though we're in the midst of a pandemic, they manufactured the crisis in the hospital by overloading the nurses where they're swamped. But you have nurses sitting up in hotel rooms collecting money, government money, FEMA money, and it's not their fault.
Right.
It's the way that they did the system.
Yeah. And they also created the patients. They created the patients
by taking, admitting everybody and putting them in with COVID-19 patients.
Wow.
19 patients. So if this is not manufactured, then what is?
Wow.
I don't know. Honestly,
wow.
That was my first red flag though, because I've been to Iraq. I was in the military. I got off a plane, and when you walk into a country during wartime, you're ready to go. I was I had my mop suit on. We were ready for battle. So it was the same kind of scenario getting off the plane in New York, landed, and it's just what do you mean I don't have an assignment and I'm supposed to sit at the Marriott Marquis in Times Square for 3 days, not doing anything? I thought this was a pandemic. Why aren't we being utilized?
Right. Yeah. Well, let me ask you this here. While you were sitting at the Marriott, and you would look at the news, would you say anything wait, this is wrong? There's plenty of nurses you're just not letting us go into to help out, to assist. Or what did you think about everything?
I was whistleblowing the entire time I was there. I was posting on my social media account, listen, I'm sitting here doing nothing. What is going on? And people were angry about that. It's a really hard thing to tell people the truth that is so absolutely unbelievable that they turned their lives upside down, and they are realizing that it was essentially manufactured, like you guys said. People have a really hard time accepting that.
Right.
Yeah, because that's going to play on the psyche, the mental.
The psyche of everybody that participated.
Yes.
Only doing what they're told to do, even though it stuff didn't feel right. Now, we're not saying, let me just put this in here.
Okay.
We are not saying that COVID-19 is not real. It is real.
Right.
But what they did was, if there was 5 COVID-19 patients and you just checking in patients, you're bringing them in that don't have COVID-19, or you don't know if they have COVID-19, and putting them and blending them in with COVID-19 patients.
Yeah.
And then you have to do a test. It's going to take 6 to 10 days to get the test back. How often were you able to change your PPE? Were you able to change it out to each patient?
Yeah, when I got there, we had enough PPE to go around. It was just that it was just being used improperly. People get really lazy. So imagine, like, they're telling you everyone's gonna die anyway. People are like really careless with it. They're like, they're gonna die anyway. You know, so I literally felt like I was living in the Twilight Zone. Like, this is not what nurses stand for. Like, we're supposed to be the patient advocates. And like, everybody was so absolutely terrified to say anything. One, because they didn't want to lose that big paycheck. And two, you know, the lashback, you know, when you speak out about something, isn't the most fun thing to go through in the world, right. You know?
And speaking of PPE, you know, now, what, 3-4 months later, they want to, I've noticed that a lot of, especially liberal states, they want to make it mandatory that everybody wear a mask. So if COVID-19, coronavirus, however you want to word it, is, as you stated, in the blood, then how is a mask going to stop a virus
from spreading?
That's a big deal to me too. Like, specifically today, I have 3 little boys, and I told them I don't want my kids in masks. Like, this is ridiculous. And behind my back, they put them in a mask. And I worry about this moving forward, especially for our children growing up and thinking that this is the new normal and how we have to be, and afraid of everybody. But the masks themselves, unless you're fitted properly, you know, we have to get fitted in the hospital by a professional with them, you know, to make sure that it's a secure on our faces. But these cloth masks and these, you know, surgical masks that they're getting at dollar stores, they're making things worse, and they're making people very fearful of everybody else. We can't live in that fear. We live among millions and trillions and billions of germs every single day. God gave us our immune system. We need to take care of ourselves. You know, it's not a germ theory. It should be a terrain theory. We need to take care of body, mind, soul in order to be, you know, healthy and be able to, you know, get that herd immunity that essentially is what's happening, you know.
Right. So instead of flattening the curve, we need to flatten the fear, because when I see the mask like that and everybody being hysterical about it, it's like you are showing, that's a sign of fearfulness as far as I am concerned, because if it's not going to stop anything, if anything, it's going to restrict your oxygen intake, and then you won't be able to breathe out the carbon dioxide. You actually will be rebreathing in your own breath, which is carbon dioxide. So it reminds me of being inside of a vehicle, inside of a garage with the car engine on and no air able to circulate, no oxygen for me to even get in. It's like I'm smothering myself. And if the government or some in the government want to mandate this, I feel like they want to take and smother Americans by shutting us out, but it's making us more sicker, which would then cause respiratory and breathing problems. And now people will have to go where? To the hospitals. And if they're suffering from these different conditions and you're making $39,000 a pop, if you put somebody on a respirator or ventilator, I mean,
it's a big, let me ask you this here. First of all, what I don't understand is when all of these people were dying, they didn't require a mask. Now that the mortality rate is low, 98% recovery rate, now they want everyone to wear a mask. That's what I don't understand. Also, I noticed that there were no autopsies did during this time. Who ordered that there be no autopsies done on bodies?
I was going to bring that up because that's a huge thing. That's a huge, huge deal, especially to these families. Governors. Why? I mean, I have a friend of mine out of New Jersey actually that has been trying to get an autopsy on her husband. He's been in the morgue I guess, waiting for over a month because she's fighting it, and they won't. I mean, that you already didn't allow the family in, and now you're not allowing the family to investigate. They deserve that much.
If no autopsies are done on people, loved ones, where's the proof that they even died of COVID-19?
Right.
That they don't want people to know that or find that out.
How are they being added to the statistic pile?
Mm-hmm.
How is that? Make me understand this here. This is not right. How, if you won't allow the family member to do an autopsy or have an autopsy done on their loved ones, like she said, how do we know that they died of or with COVID-19? And why are those numbers being added to the statistics to make it look like, okay, this is going up, it's going up, it's going up.
Right.
When there's no autopsy, how do we know that the person didn't die of a stroke or of a heart attack?
Well, you don't. They want you to know that. I know that. I have video evidence and photo evidence of COVID negative tests done, three COVID tests done over extent of 2 weeks, all negative, and the patient was on a vent and with a diagnosis of a COVID positive. That patient now is in a body bag, out probably in the freezer, who knows where, and their families aren't allowed an autopsy. That's murder.
That's straight murder.
Yeah.
Go ahead.
And then when you talk about these false positives that's coming back, you know, I was informed that some of them is like 40 to 50% false positives that's coming back. And so if you don't know if you even got this, but they're taking and putting your loved one on a ventilator, like you said, that is murder.
Let me ask Erin this. Erin, as a nurse, when someone come in, shortness of breath, fever, before they go on a ventilator, what is the proper protocol on how they should be treated?
Yeah.
Well, like we did it in Florida, is you look at the whole person. Like, what is their history? What could be causing this other than COVID? You know, do they have a history of anxiety or depression? Look what the media is doing to people. It's making people crazy. Look at their fighting in the street. You know, I mean, it's causing their lives are upside down. That's a huge reason that I saw a lot of people come to the Florida emergency room, is because they were so worried and, you know, couldn't breathe.
Yeah.
Like, you know, and so you're looking at the whole person. You're going to run different tests. Could they have something else? Could they have the flu? We were doing in the emergency room here, we would do a flu test first and rule that out, and then do the COVID test. You know, so it's the process of elimination.
Mm-hmm. That's what you did in Florida.
Yeah, but in
New York.
No.
Wow.
I mean, if they came up with that, admit them, and we'll test them in the emergency room, send that out, and they can be shipped up to a floor that has other COVID patients. The nurses and the doctors don't really care anymore because everybody's going to die, so they're not really using their PPE properly. They're just going room to room to room. I mean, if you get admitted to a hospital like that, under that authority or whoever's making these decisions, you're not walking out. It is essentially an assembly line to a body bag.
So do you think that it's time for a federal investigation to be done? And to
yes.
hospital, not just in New York, but into every last one of them, so that we can understand this, especially since the autopsy have not been done.
People haven't had funerals, but ashes are just showing up in the mailbox for them. That consistency of their loved ones.
It literally gives me chills, and I can't, like, there's a lot of nights I can't even sleep. Like, that is the goal. I would love to see a federal investigation. I would love to see our healthcare system reformed with a huge focus on ethics. And I would love to have the government, with governors like Cuomo, who have never stepped foot into one of those hospitals, stay out of the doctor-patient relationship, because it's none of their business. It's not his business. And that has caused this.
Especially with signing the executive order to allow COVID-19 patients into the nursing homes there. in New York.
I know.
That was really disturbing, and I do not hear a lot of people outraged about that. Where are our legislators? Well, he is the governor. I mean, you know, a lot of people complain about a lot of stuff that's going on in a lot of these cities and these states, but look at who's running these cities and states. Because here I am calling for somebody to help, but it's the governors, the people that's signing these executive orders to implement these things that is being detrimental to people's lives.
When you say detrimental, let's go back to the ventilators for a moment.
Yeah.
If some of these people were in their right mind, they were conscious, were they coerced to go on to a ventilator?
Yes. Actually, there's a letter from a man that we have that wrote in his own handwriting that he did not want this treatment. He was being forced onto it, that he knew he didn't have COVID, that he was admitted against his will and they were keeping them there, sedating him, and that if he dies, he wants his death fully investigated. So these people were coerced into these ventilators, and this is how they reasoned with them. They would tell them, you're either going to die from COVID or you need to get some help with your breathing. That help meant being put on a ventilator. And guess what that ventilator led them to? A body bag.
So let me ask you this here. Someone was held against their will. Yeah. How can a hospital hold anyone against their will? How did they do that?
A liability-free environment, but they forgot that liability-free order didn't include gross negligence, and that's a key point in this, and that's why we need a federal investigation.
Yes, yes. And then it was with intent and deliberate too. It was with intent and deliberate.
I looked at one of the videos, and you was talking about a DRN. I guess that means do not resuscitate, or can you explain what happened between a patient and the nurses and the doctors? Because explain that to us about what was happening with the patient and the do not.
So that's a DNR order is something specific that a family or a patient discusses with their doctor, you know, either before they're admitted to a hospital or during. This specific instance, it was a 37-year-old man, and I took it pretty to heart because I'm the same age and that could have been me. And that's how I'm always looking at these patients like, man, that could be like me, or that could be my dad or my mom or my brother. And he was a full code, which means, and his family specifically said this like 2 hours prior, no, we want you to do everything you can to save our son. Done. Like in my mind, that's it. I'm going to respect the family's wishes. I'm not going to be here to play God, and I don't expect anyone else to do the same. But got in there for a shift, and the doctors, I should say, like they were fellows and residents. The attending agreed with them, actually, that we're not going to code this patient because he's not going to live anyway. And a code is resuscitation measures. And we flip. I mean, that's what I'm saying. A lot of these nurses that were there with me, we all felt the same way. It just takes a very few to like actually speak out because it's scary. But he ultimately ended up dying with a group of us nurses arguing over his body with the doctors who were telling us not to. And that was probably like one of the most difficult things. I lost it. I was just bawling in tears. You know, it was just like, I don't understand how callous people in our medical community like can be to be these order followers and not question things.
Right. Let me ask you about the doctors. Do these doctors truly work there? Did they come in from other places?
Right. Yeah.
Who are these doctors?
A lot of them, I would say the majority of the doctors there were Mount Sinai residents from New York. So they graduated medical school, the textbook school side, and now they were in their residency clinical.
Okay, so they really wasn't a full doctor yet.
they shouldn't have, like, they have to be monitored by an actual physician. Like there's, you know, a teacher essentially.
Right.
But that didn't happen. I never saw attendings. Attendings were like their teachers, and you didn't see them. They were sleeping half the time. So it was just the residents running the show. And half the time, you know, they didn't really know what they were, well, I wouldn't even say, I would say 90% of the time they didn't know what they were doing, and they're taking wild guesses. So if you weren't there with your patient, I like didn't even want to leave the patient's room, because they would go in and change settings and play around, and they'd want to put in new line. It was just, it was like these people weren't people anymore at that point.
Wow.
That is so,
and it's sick
and sinister.
Yeah.
I always said something sinister was going on, Erin.
Yeah.
So where are you going? Where do you go from here? You know, are people coming after you? What can the world do to help? Because we have to open up people's eyes. It's something's
something else happening here.
Right.
It's not COVID. It's something bigger than COVID going on here.
Right. Right.
I'm not afraid to tell the world about it. And it's funny, because when my video came out, I'm getting messages from all around the world at different facilities from nurses and doctors, and they're saying, oh my gosh, we were doing the same thing. The same thing was happening in our hospitals. I'm getting messages from families around the world, you know, sharing the same type of treatment that their family members underwent, you know, after requesting records and that. So we have to, we have to have some sort of investigation.
Right.
To give these patients and their families justice, but also so this never repeats itself ever again.
Yeah. Now we have the second wave coming. The second wave is here. People are testing positive. The good thing is 98% are recovering, and the mortality rate is down. What would you tell people if they're going to a hospital, what to look out for?
I don't want people to fear hospitals.
Right.
I want them to go in there with knowledge, and go in there definitely with, I'm trying to think of the word. Hang on, sorry.
That's okay.
That went out. They need, what is it that they need?
Go ahead.
They need a power of attorney set up.
Okay.
Power of attorney set up. They have to have their will set up, and they definitely need to demand an advocate at all times. And if they choose that they don't want to be put on a ventilator, they can request a DNI to do not intubate. And they can request and demand this alternative treatment that we know is working, the hydroxychloroquine and zinc. It's cheap and it's working. 100% effectiveness before I left to New York at my hospital.
Yeah.
I mean,
why do you think that they don't want, a lot of the people that is restricting this don't want hydroxychloroquine and the Z-Pack? They don't want that.
I think that they made this political.
Right.
At the end of the day, they made this political. I think that, and I try to stay away from this, because this is not a partisan issue. This is a humanitarian issue. Mm-hmm. But it's pretty obvious to even, you know, the layperson, that the majority of these states that are having these epidemics are Democratic states with Democratic governors, and they're not incorporating a treatment or treatments that are effective in treating these patients successfully. They would prefer to be right versus actually helping patients or saving them. Wow. Like that was the thing with Governor Cuomo in March. How did he know that he needed to order 30,000 vents?
Right.
We were asking the same thing too.
Yes.
How did he know that? And why would he get on television saying that we need more ventilators? We need more ventilators. Like there were no ventilators, but there were ventilators behind him. And then found out later he was stockpiling them. So what plans did he have?
Right.
For people.
So why, if he's going to ask for 30,000 ventilators, he should probably ask for 30,000 people to run them. He forgot that important piece of the puzzle there. I mean, it's critical thinking. If you're going to be running an entire state, you should probably have that figured out. You know, you can't just order a bunch of, it's like ordering 30,000 cars and asking 13-year-old kids that don't have their license to drive them around.
And that's only one 13-year-old instead of 30,000 of them. And then not to mention there was a big boat that was shipped in and converted for COVID-19.
I'm going to ask you this here question. And that big truck that was sitting outside, that was actually filled with bodies.
The truck outside? Yeah. See, the bodies came from the malpractice and negligence, and, you know, there was bodies in there, but they weren't from COVID. You know, I mean, I had to put a lot of my patients into that truck, and it didn't have to be like that. You know, that's the hardest part, is like knowing that that's it. You know, like, and there's no answers for these families. They toss their belongings in the garbage. That's one thing that I just was disgusted with.
Erin, how are you going to get through this here psychological? I mean, you're saying it to us.
Yeah, I won't put that part in.
But how? Because I'm really, this is making me
you're making me cry now.
Yeah.
What are you going to do
to even be able to handle this?
When this died down and it really and truly hit you, I didn't work in the emergency, but I knew something was going on, and I would weep and cry because I knew it. So what are you doing psychologically to handle what's about to come? It's going to hit you.
I know. Man, it's hard. You know, I was born for this, I think. I don't know. I have to be strong because I feel like people are counting on me now, you know, and I don't want to let them down, and I'm going to just keep fighting because I just want everyone to listen to the truth. And even though it's, maybe right now I'm in the flight part of the flight or fight, but I'm not going to stop fighting until I'm listened to. Everyone. Because you know what? I don't even care if it was 2 patients. Like
2 patients too many.
It's not. People are not disposable.
That's right.
Like, they're just not. And and they have families and they have stories, and that's what keeps me going, is that I can fight for them because I'm their voice now.
Right. And we need you, Erin. Yeah. And that's going to make other nurses and doctors feel safe to coming forward to stand up and standing up to this here, because there is something wrong. Something is not right. Yeah. The system, the way things are being done, and it's scaring everybody. The media has put everybody in fear and panic, and it is controlling everybody's every move. And that's why they just, I better not say nothing because this may happen, that may happen. When we're going to have to speak out, because this is not how things are supposed to be ran. This is not how they're supposed to be ran, and you have to keep speaking out. You have to be the voice now.
I don't plan on stopping. And you know, like my parents would always laugh that I'm the stubborn one. Well, here I am. You know?
So was a lot of the people that passed away, were they elderly?
Age honestly didn't really matter. No, I mean, no. I can't say that they were not elderly.
On the outside looking in, it was telling us that it was a lot of elderly that was passing away.
Mm-hmm. Yeah, that's not true. No,
it was. But this is the epicenter in Queens, New York.
Right, but it's like all they wanted was a body, and anybody's body would do.
Especially if they put you on a ventilator for $39,000.
Did they put any children on a ventilator?
No, I don't think the children wasn't.
Wait, let me just ask. Cause see, we thought it was older people, and now come to find out it's not.
Well, the numbers are probably high for the elderly people because of that whole nursing home fiasco.
Right.
So, but what I was seeing on the actual floors were, I had a wide range of ages, anywhere from 20s all the way up to, I mean, there was 80-year-olds, but mostly in between there. You know, it didn't matter. So, I mean, look at the 37-year-old that, you know, they just let die, which is disgusting. But next to him was another 35-year-old. They let him die too. I mean, like, they don't even have a chance, and they can't even like tell you what they want because they're on a vent, and then nobody cared. It's just like the perfect storm. And then they got outside. They have bands out there calling everybody heroes. And it's just like, how?
It seemed like it was something that was staged, like
a Hollywood movie.
Yeah.
Because I couldn't understand how nurses was out there dancing when patients were dying. I just didn't get, like, if you have empathy and compassion, I can't go from seeing a death where I'm outside dancing.
Right.
So I just couldn't. Were these real nurses working with you? Were these people real nurses, or were they actors?
No, they were real nurses. But, you know, even in nursing school, though, you would know who was there for the money versus who was there to, like, actually help people. And that's in any profession. You know, people go on to a lot of things for the wrong reasons. And so there are some good nurses there that would fight with me, but not very many.
So I just want to piggyback on one more thing about the positive testing of the positive and the second wave and all of this stuff.
Yeah.
So from my understanding, at the beginning of all of this here, the only people that they were testing were the people that were sick. Now, with them having all of these testings, everybody is getting tested. So when you talk about like a second wave, there's more people that's being tested, and a lot of people have already built up the antibodies towards this quote unquote virus. Mm-hmm. So it's not necessarily a second wave where the virus is just taking and attacking people. It's basically more people getting tested. Mm-hmm. Correct?
Yeah, I mean, if you look for it and you test for it, you're going to find it.
Okay.
And you know, they're lining up, and they're perfectly healthy, lining up to get tested. I don't understand that. Like, that's the whole point of herd immunity. You know, get enough people that get it, get over it, and that's that. And then, you know, we move on to the next germ that we have to, you know, it's life. I mean, we're born into this.
But and I even also heard, Erin, where in one nursing home they had called to see how that nursing home was. Nobody was sick, everybody was good, but they said that they were still coming down to test that particular nursing home. Said after the testing, everybody in the nursing home had COVID and they were sick and they started dying.
Yeah. I don't have answers for that, but it doesn't.
Not everybody in the nursing home, some in the nursing home. But nobody had it. But as soon as they started their testing procedure, it wiped out a whole floor of people.
There you go. Yes.
A whole unit.
That's a whole nother federal investigation. You know, I mean,
well, it's time to do something because, you know, this is our country as American citizens.
Right.
We pay our taxes. And we pay the salaries of a lot of these different politicians and different people that's in certain places. So we as American citizens and Americans, we need answers. We need answers now. For them to take and shut down our economy and damn near destroy people's livelihoods, businesses deliberately, and I feel for political reasons. We need answers now, because to put in an executive order and restrict people from getting medicines that can help people. Yes. Something was going on here, and we need to get to the bottom of that something so that something won't repeat itself.
That's right. That's right.
Yeah.
Erin, thank you so much. Thank you for having this lovely conversation with us. We need for you to keep up with the fight. I think that the whole country have your back. Yes. Forget about the trolls.
Forget about them.
But I think that when people start opening up their eyes and realizing that we are in a psychological warfare and it's hurting people and even literally getting people killed, people will stand up and fight for your country, fight for your rights, and even fight for your fellow man, your brother or sister.
That's right.
So thank you so much, Erin, for being with us.
Thank you guys so much too. And we're in this together, and I appreciate
Yes, we are.
so much, and I love you guys.
We love you more. Thank you, Erin. We'll be in touch.
Okay.
So there you have it with Erin Olszewski talking about what was happening at the epicenter in Queens, New York.
Wow.
You know, we were right. Our guts were right.
Yes.
Thank you all so much for joining us for this amazing segment.
Yeah.
And here is what I need for you to do. You see something, you say something.
That's right.
Always remember to keep your integrity and keep your compassion when it comes to your fellow men.
That's right.
We are better than this.
Yes,
we are Americans. All of this other stuff that they're trying to pull on the American people, it's time that we stand up against it.
That's right.
Until next time.
Bye-bye.
I'm Donald Trump, and I approve this message.
My administration will take all necessary steps to safeguard our citizens from this threat.
Hysterical xenophobia.
Be giving Americans a false sense.
Is it accurate that if these steps had not been put in place, it could have been 2 billion people dead here in the United States?
Yes. No matter how hard they try to stop us, they can't. We built the greatest economy the world has ever seen, and we're going to do it again. Together, we're beating back the invisible enemy.
What the federal government did was a phenomenal accomplishment.
Through it all, the world has witnessed the unyielding resolve of our incredible American people.
Promise made, promise kept.
And I'm fighting for you, and I love doing it with everything that I have. And you know that. With the grace of God, we will win this war, and we will win this war quickly. And we will make America great again.
Hey, y'all.
Hey.
Come on in.
Come on.
Come on a little closer.
Come on.
Because we got something to tell you.
That's right.
Now, y'all know we just finished the last chapter of our book called Uprising.
That's right.
Which is due out on August the 18th. Go to diamondandsilkbook.com to pre-order right now.
That's right.
But wait.
Wait.
There's more. Now, we already know that old Jim Crow Joe said we ain't black. But the last time we checked, we black.
That's right.
And you know what?
What?
We have a message for old Jim Crow Joe. Just because we're black, it don't mean we have to vote Democrat.
That's right.
Maybe we can teach old Jim Crow Joe a thing or two. So in this book, we write about our truth.
Our truth.
And in case you forgot, let me remind you again.
Yeah.
The name of the book is Uprising. Who in the hell said you can't ditch and switch?
That's right.
So we done already woke up America. Maybe it's time to wake up Jim Crow Joe and these Democrats.
Maybe.
Maybe it's time for you all to experience the awakening of Diamond and Silk.
Maybe.
So now you don't get to judge us based on what somebody said about us. Now you can read it for yourself.
That's right.
So pre-order the book at diamondandsilkbook.com. That's diamondandsilkbook.com.